This is Houston Newsmakers Extra. We've been talking about pancreatic cancer, two things. Number one, there's a walk next week on November 19th, and it's to raise money and funds for the Pancreatic Cancer Foundation, a national foundation. And Rhonda Williams is here. She's the founder. Dr. George Van Buren is a physician in the Baylor area, and you have been working specifically on pancreatic cancer type issues, correct?
Correct, yes.
How do you talked about the fact that we're 5-year survival, and that's like improvement over what it was. How do you work at a pace that you work at knowing that every little bit is going to help, even that little bit? It's 5 years, you say, that's not a lot, but that's a lot for somebody who's got a terminal diagnosis.
Well, one of the things, as Rhonda had touched upon earlier, that we really focus on with our patients is, first of all, that every patient's an individual, and as the research and funding improves, the hope for a newer therapeutic or a newer drug or a newer technique that's available to help that patient is right around the corner.
Do we know what causes pancreatic cancer, or is that just one of the really mysteries?
So it's a genetic break in our own pancreatic ductal cells that occurs. There's obviously a tremendous number of environmental factors that can contribute to it. We do know there are risk factors: smoking cigarettes, chronic pancreatitis. We're now looking at the relationship between diabetes and pancreatic cancer and seeing if those are contributing factors. But clearly there's a number of environmental factors that also contribute to it as well. The challenge we face is finding those patients early on in their course or before it even turns into cancer to help treat them either with surgery or medical therapy.
So what kind of screening is there available for somebody to go, let's say right now, I don't know if I'm a candidate for that, if my body biologically might be conducive. Is there something available that people can get screened?
Great question. You know, so one of the challenges in pancreatic cancer is our screening is good, it's not perfect. Usually that does involve a CAT scan of the abdomen, and we have gastroenterologists do a specialized procedure called an endoscopic ultrasound, where they can do an endoscope with a little ultrasound probe on it and look very closely at your pancreas, as well as some blood tests that we can do to help screen them. In addition, at our Dan L. Duncan Cancer Center, we always have genetic counselors who will evaluate the patient and help screen them in their bloodline to see if there's anything that predisposes them for a higher risk.
I imagine that's not exactly cheap, and I imagine that most people can't walk in and get one of those.
Correct. Unfortunately, in 2023, medical care is challenging, and the funding of that is challenging, which is one of the fantastic things about foundations that do help patients with financial support for it, because treatment of any cancer, but more specifically pancreatic cancer, can be debilitating.
Rhonda, I want to talk about your passion for this mission. I'm sure that some of the drive had been that you lost a mother-in-law, correct?
Correct.
To that. That's got to be some of the drive. What else is it about all of this and who you've met along the way that gives you the passion to keep driving and try to do what you can to raise awareness and money?
You know what, it's so personal to me. I was my mother-in-law's caretaker. So she was being treated in Chicago, and I lived in Denver, and at the time I was a flight attendant, and I would fly there and do caretaking for her. So I was there from the beginning to the very end. And it's very painful. It's tragic for the whole family. It just hits everyone. So I wanted to do something that could alleviate some of the financial burden, give people hope that someday we'll have something that can. Crucial early detection is just what we really strive for, is to get the early detection, and it's important to really know your body. Mm-hmm. If there's something not right, be an advocate for yourself. Go see your doctor. And push them. Say, hey, I really think there's something wrong here. So I want to educate people on what the options are for pancreatic cancer treatment and where the best places are that you can go to get that treatment.
Where do you see the foundation going? What are your goals at this point for what you hope this foundation will be able to do and what it will be able to achieve?
Well, we're hoping to achieve research in multiple different areas to help the patients just get better treatment and have survival rates much higher than they are right now. And we also want to be there to support them emotionally. We have, we have a very small staff, but we do have a chaplain on staff that that they can talk to, and and we also have support groups where people who have survived, and we have a board member who survived 15 years, and she was stage 4. So we have people in places that can talk to these people and say, this is what I did, or this is how I handled it. And everyone's different, everyone's body's different. They're not necessarily going to get the same outcome,
right.
but at least they have the hope that they can, live longer.
And we've seen the images of many people who are well known in this country who've died from pancreatic cancer, from Ruth Bader Ginsburg to Alice Trebek to Congressman John Lewis. The list goes on and on. If someone wants to get involved to help your foundation, how best can they contact you? What is your website, and people can get in contact?
Our website is www.npcf.us, so it's just the National Pancreatic Cancer Foundation, abbreviated .us. That's the best way. They can also reach us at our phone, 800-859-6723. Either way, they can get in touch with us.
We're going to make sure that people, obviously, this is Newsmakers Extra, so everybody has a chance to share this with everyone you know. Enterprise has been a big partner with you and the walk as well. I should have said that on the show. I didn't say that. Sorry, Enterprise. But they've been a big supporter, and they are as well. Then because of a personal connection with someone at Enterprise is how they got involved with this as well. You can't hurt to have that kind of connection.
Right. Well, Joe Cardello unfortunately lost his father to pancreatic cancer, and he reached out to us a few years ago and said, hey, we want to do a walk. We want to do some fundraising for pancreatic cancer. So we put together the first one, and every year we've continued to do it. And Enterprise is a great supporter of our mission.
Good deal. Good deal. We're glad we were able to get that in, and hopefully people will go to the website to help out. The walk itself is November 19th. That's the date. Circle it. Be ready to go ahead and do some things. Thank you, Dr. Van Buren, for your conversation. It really gave me a lot of insight about things about pancreatic cancer that I might not have known. I was checking in that screening thing. I don't know. That's pretty expensive, so we got to figure out how to do that.
Yes.
Do you got something else you want to say?
I do. We also have a local Facebook page, so National Pancreatic Cancer Houston chapter.
Okay.
So people can go on there and like the page and get information about the walk.
Okay. That'll be on the Newsmakers page on clicktohouston.com as well. Thank you so much, both of you. Good luck on the walk. Can't promise good weather, but sure, why not? 50% chance it's going to be good weather.
We do it rain or shine, doesn't matter.
Okay, good deal. Thank you. Hey, this is Houston Newsmakers Extra. Share this with everyone you know.